Welcome to the December 2019 data update. Today we will focus on regional and county level pay-for-performance data.
Let's begin by reviewing important talking points for today's board data presentation. First, we will review the changes to the P4P baseline and improvement targets. Then we will take a look at current rates for the active 2019 pay-for-performance metrics and improvement targets, where we will be describing regional and county level strengths and opportunities.
There are two documents that will be helpful to reference throughout this webinar: the P4P adjustment reports and the P4P measures update reports. The Healthcare Authority Measurement Guide also offers detailed information on the pay-for-performance metrics and their definitions. We have not included it as an attached reference here, but you can find a copy on our website or on the Healthcare Authority website.
Let's start by looking back at the metric adjustments, which lays out how and why the HCA adjusted improvement targets and baseline rates and percentages for the 2019 active P4P metrics and submetrics. The changes include global recalculations of 2017 pay-for-performance baseline and improvement targets, adjustments to the DSRIP accountability program, and adoption of annual specification updates by measure stewards. As a reminder, pay-for-performance metrics are based on improvement targets. There are two ways improvement targets are created: gap to goal and improvement over self. Gap to goal metrics are created utilizing national Medicaid metric targets. Essentially, they ask how the North Sound region is doing compared to those national targets. North Sound's gap to goal is identified from a baseline year. Improvement over self takes the North Sound's baseline data and applies an annual 1.9% improvement over the baseline. Since the HCA released 2017 baseline results, it has made significant improvements in tracking eligibility and third-party insurance coverage in the administrative data system. Given these improvements, the HCA chose to recalculate the 2017 baseline and improvement targets. Baseline and improvement targets changes due to adoption of annual technical specifications occurred for two metrics: patients prescribed high-dose chronic opioid therapy and patients prescribed chronic concurrent opioids and sedatives. This change was primarily due to adoption of updated MED approaches maintaining alignment with the measure steward, which is BRIE Collaborative, as well as CDC guidelines and refinements. These metric baselines and improvement targets were changed. In addition, the Healthcare Authority implemented three metric changes that affected the DSRIP accountability framework: controlling high blood pressure, medication management for people with asthma, and dental sealants for children at an elevated risk level. Controlling high blood pressure and dental sealants for children will be removed from the metric list until further technical guidance can be received. Medication management for people with asthma will become a single metric, consolidating age bands into one metric for ages 5 to 64 years.
In October of 2019, the Healthcare Authority released updated baseline and improvement targets for 30 metrics and submetrics. A percent change calculation was used to look at the changes from the original baseline and improvement targets to the updated baseline and improvement targets. To calculate the percent change, staff subtracted the original numbers from the updated numbers and divided the results by the original number and multiplied the quotient by 100 to get the percentage. Looking at baseline adjustments. The largest percent change in baseline was a decrease of 13.2% for plan all-cause readmission ages 18 to 64 years, with an original baseline of 13.5 and an updated baseline of 11.7. While the smallest percent change in baseline of 0.01% occurred with the metric comprehensive diabetes care medical attention for nephropathy, with the original baseline of 87.45 and an updated baseline of 87.46. Now, let's look at improvement target adjustments. The largest percent change for improvement target was a decrease of 13.2% for the metric plan all-cause hospital readmission ages 18 to 64 years, with an original improvement target of 13.3 and an updated improvement target of 11.5. The smallest percent change and improvement target belongs to the utilization of dental services ages 21 years and older at 0.04%.
We also calculated percent change for changes in the numerators and denominators of the baseline rates. The largest percent change for the updated 2017 baseline data numerators was for plan all-cause readmissions ages 18 to 64 years. The numerator increased by 156 individuals, 23.7%, with an original numerator of 652 and an updated numerator of 815. The smallest percent change for the updated 2017 baseline data numerators was for patients prescribed high-dose chronic opioid therapy greater than 50 milligrams MED, with the numerator decreasing by 4 individuals, or 0.1%, from an original numerator of 4,719 to an updated numerator of 4,715. The largest percent change for the updated 2017 baseline data denominators was for plan all-cause readmissions ages 18 to 64 years. The denominator was increased by 2,072 individuals, or 42.5%, from an original denominator of 4,874 to an updated denominator of 6,946. While the smallest percent change for the updated 2017 baseline data denominator was for percent homeless narrow definition ages 65 years and older. The denominator decreased by 5 individuals, or 0.6%, with an original denominator of 858 and an updated denominator of 853.
Okay, let's shift gears a bit. Now we will look at current rates for the North Sound region. As a reminder, during our last webinar, we presented 2017 data because improvement targets or projections from the baseline regional level scores, no targets were initially met at the regional level. Okay? To date, we will take a look at data from 2018. In the North Sound region, rates met or exceeded improvement targets for 10 of the 30 active metrics and submetrics. 7 metrics exhibited progress towards improvement target. 11 metric submetrics exhibited worsening trends away from the improvement target, and 2 metrics, submetrics, are subject to small number suppression. Estimated levels of improvement needed ranged from 1 person to 842 persons. This is for child and adolescents access to primary care practitioners ages 12 to 19 years, and for percent homeless ages 18 to 64 years respectively.
Now let's take a look at the strengths in the North Sound region, specific metrics where the North Sound region met or exceeded regional targets.
The submetric age band, adults ages 65 years for all-cause emergency department visits per 1,000 member months, has met and exceeded the improvement target by 30 fewer individuals. The submetric age band for children ages 0 to 17 years has also met and exceeded the regional improvement target by 1,200 fewer emergency department visits per 1,000 member months. Mental health treatment for the submetric age band children ages 6 to 17 years has met and exceeded the improvement target by 494 children. The submetric age band adult ages 18 to 64 years for mental health treatment penetration has met and exceeded the improvement target by 795 adults to meet the 2019 improvement targets. Substance use disorder treatment penetration for the submetric age band adults ages 18 to 64 years has also met and exceeded the regional improvement target by 745 adults.
Across the North Sound, there is also opportunities for improvement. There are areas where the current rates indicate the largest gap to meeting the improvement target.
Our most recent data for the time period ending December 2018 shows percent homelessness ages 18 to 64 years has the largest gap to meeting the regional improvement target, with 842 fewer adults experiencing homelessness needed to meet the improvement target. The largest gap is for well child visits ages 3 to 6 years, with 520 additional children needed to meet the improvement target, followed by both utilization of dental services ages 0 to 20 years and ages 21 years and older, with 469 additional adults needed and 424 additional children needed to meet the regional improvement target.
All right, Now for the counties. Let's start with Island County. Rates met or exceeded improvement targets for 10, or 33.3%, of the 30 active metrics and submetrics in Island County. Opportunities for improvement exist for 18, or 60%, of the metrics and submetrics. Two metrics, substance use disorder treatment penetration for ages 65 and older and percent homeless ages 65 and older, had no data reported during the reporting period. Estimated levels of improvement needed ranged from 4 to 1,088 persons. This is for antidepressant medication management, acute and planned all-cause hospital readmission rates 30 days, and all-cause ED visits per 1,000 member months ages 18 to 64 respectively.
Here we have listed the opportunities and strengths for Island County for your reference, but we will speak to each one while reviewing the visual.
Our most recent data for time period ending December 2018 indicates all-cause ED visits have the largest gaps for Island County, with 1,088 fewer visits for adults ages 18 to 64 needed to meet the improvement target. The next largest gap is for utilization of dental services ages 0 to 20 years, with 288 additional children needed to meet the improvement target, followed by utilization of dental services ages 21 years and older, with 261 additional adults needed to meet the improvement target. And Island County strengths include mental health treatment penetration, which has met the improvement target for all three submetric age bands. Percent homeless, another measure where fewer is better, has met the improvement target for two age band submetrics, ages 0 to 17 and ages 18 to 64. And substance use disorder treatment penetration, ages 2 to 17 years, has met the improvement target with a rate of 38%. Finally, antidepressant medication management continuation has met the improvement target with a rate of 41.6%.
Okay, moving on to San Juan County. Rates met or exceeded improvement target for 9, or 30%, of the 30 submetrics in San Juan County. Opportunities for improvement arise for 18, or 60%, of the submetrics. Three submetrics, substance use disorder treatment penetration, ages 65 years and older, percent homeless, ages 65 years and older, and percent homeless, ages 0 to 17 years, had no data reported during the reporting period. Estimated levels of improvement needed ranged from 5 to 242 persons. Antidepressant medication management acute and utilization of dental services ages 21 years and older, respectively.
Here we have listed the opportunities and strengths for San Juan County for your reference, but we will speak to each one while reviewing the visual.
Our most recent data for time period ending December 2018 indicates utilization of dental services have the largest gaps for San Juan County, with 242 additional children ages 21 years and older and 105 additional children ages 0 to 20 years are needed to meet the improvement target. The next largest gap is for well child visits, 3 to 6 years, with 32 additional children needed to meet the improvement target. In San Juan County, all-cause ED visits for all age bands have reached their improvement targets. Percent homeless, ages 18 to 64 years, a metric for which the lower rate is better, with a rate of 1.2%, has met the year 1 improvement target. Mental health treatment penetration has met the improvement target for all age bands, and child and adolescent access to primary care practitioners ages 12 to 24 months with a rate of 99.6% has met the year 1 improvement target.
On to Skagit County. Rates met or exceeded improvement targets for 16, or 53.3%, of the 30 metrics and submetrics in Skagit County. Opportunities for improvement exist for 12, or 40%, of the metrics and submetrics. Two metrics, substance use disorder treatment penetration ages 65 years and older, and mental health treatment penetration ages 65 years and older, had no data reported during the reporting period. Estimated levels of improvement needed ranged from 4 to 944 persons for child and adolescent access to primary care practitioners ages 7 to 11 years and all-cause ED visits per 1,000 member months ages 18 to 64 years, respectively.
Okay. Here we have listed the opportunities and strengths for Skagit County for your reference, but we will speak to each one while reviewing the visual.
Our most recent data for time period ending December 2018 indicates all-cause ED visits per 1,000 member months ages 18 to 64 have the largest gap for Skagit County, with 944 fewer adults needed to meet the improvement target. The next largest gap is for utilization of dental services ages 21 years and older, with 436 additional adults needed to meet the regional improvement target. The third largest gap is for all-cause ED visits per 1,000 member months ages 0 to 17 years, with 219 fewer children needed to meet the improvement target, followed by chlamydia screening in women ages 16 to 24 years, with 49 additional women needed to meet the regional improvement target. Skagit County strengths include utilization of dental services ages 0 to 20 years with a rate of 65.4%, which has met the year 1 improvement target. Mental health treatment penetration has also met the improvement target for ages 6 to 17 years with a rate of 78.2%. And primary caries prevention intervention as offered by medical provider has met the year 1 improvement target of 4.9% with a rate of 7.3%.
Moving on to Snohomish County. Rates met or exceeded improvement targets for 13, or 43.3%, of the 30 metric submetrics in Snohomish County. Opportunities for improvement exist for 16, or 53.3%, of the metric submetrics. One metric, substance use disorder treatment penetration, ages 65 years and older, had no data reported during the reporting period. One metric, percent homeless, ages 65 years and older, was subject to small number suppression. Estimated levels of improvement needed ranged from 4 to 1,097 persons for child and adolescent access to primary care practitioners ages 12 to 19 years and all-cause ED visits per 1,000 member months ages 18 to 64 years respectively.
Here we have listed the opportunities and strengths for Snohomish County for your reference, but we will speak to each while reviewing the visual.
Our most recent data for the time period ending December 2018 indicates all-cause ED visits per 1,000 member months ages 18 to 64 years have the largest gap to improvement target for Snohomish County, with 1,097 fewer adults needed to meet the improvement target. The next largest gap is for percent homelessness ages 18 to 64, with 834 fewer individuals needed to meet the regional improvement target. Utilization of dental services ages 0 to 20 years requires 639 additional children to meet the year 1 improvement target, followed by patients prescribed high-dose chronic opioid therapy greater than 50 milligrams MED, with 350 fewer needed to meet the improvement target. Snohomish County strengths include utilization of dental services ages 21 years and older with a rate of 27.5%. It has met the year 1 improvement target. Substance use disorder treatment penetration ages 18 to 64 years has met the improvement target with a rate of 41.3% in Snohomish County. Patients prescribed concurrent opioids and sedatives, a rate where the lower percentage is better, has met the improvement target at 28.8%. And all-cause ED visits per 1,000 member months, ages 0 to 17 years, another rate where the lower percentage is better, at 28.8%, has met the improvement target of 28.5% ED visits per 1,000 member months.
Right. Finally, we will look at Whatcom County. Rates met or exceeded improvement targets for 16, or 53.3%, of the 30 metrics and submetrics in Whatcom County. Opportunities for improvement exist for 13, or 43.3%, of the metrics and submetrics. One metric, substance use disorder treatment penetration, ages 65 years and older, had no data reported during the reporting period. Two metrics, mental health treatment penetration, ages 65 years and older, and percent homeless, ages 65 years and older, are subject to small number suppression. Estimated levels of improvement needed range from less than 3 to 791 persons. For medication management for people with asthma at 75%, ages 5 to 64 years, and utilization of dental services, ages 21 years and older.
Here, we have listed the opportunities and strengths for Whatcom County for your reference, but we will speak to each one while reviewing the visual.
Our most recent data for time period ending December 2018 indicates utilization of dental services ages 21 years and older have the largest gap to meeting the improvement target for Whatcom County, with 791 additional lives needed to meet the improvement target. The next largest gap is for primary caries prevention intervention as offered by a medical provider, with 308 additional children needed to meet the regional improvement target. The third largest gap is for percent homeless, ages 18 to 64 years, with 119 fewer individuals needed to meet the improvement target. In addition, chlamydia screening for women ages 18 to 24 years requires 37 additional women to meet the regional improvement target. Whatcom County strengths include all-cause ED visits per 1,000 member months, ages 0 to 17 years, a rate where lower percentage is better, with a rate of 21.9%. This has met the improvement target of 28.9 ED visits per 1,000 member months. All-cause ED visits per 1,000 member months, ages 18 to 64 years, a rate where a lower rate is better, with a rate of 50.4 per 1,000 member months, has met the improvement target of 57.7 ED visits per 1,000 member months. And finally, mental health treatment penetration, ages 18 to 64 years, with a rate of 50%, has met the year 1 improvement target.
Okay. As a region, we are well on our way to meeting improvement targets. Across the North Sound, we have seen both strengths and opportunities for continued improvement. When we view commitments by county, we have a fairly even distribution of partners. These partners are building upon our strengths to address the areas where there are opportunities for improvement. Moving forward, some of our next steps include a couple of reports around data. Updates from the latest reporting period. Baseline and improvement targets for 2018 will come out soon. Results from the 2019 VBP survey, and then achievement value estimates based on current data.
All right. Thank you so much for your attention today.